everyone. For my dental science and health project, I will be talking about tetracycline and its effects on the teeth. During this presentation, I will be talking about the common uses of tetracycline, how it affects pregnant mothers, and how it affects the oral cavity, and how you can treat tetracycline effects. Now I will talk about some common uses of tetracycline. Tetracycline is used to treat a wide variety of infections. It treats only bacterial infections. Tetracycline is used to treat and prevent acne. Tetracycline may also be given to a patient to reduce or temporarily eliminate the bacteria associated with periodontal disease. It is prescribed to suppress the destruction of the tooth's attachment to the bone, and tetracycline also reduces the pain and irritation of canker sores. These are all great common uses of tetracycline, but tetracycline also has its harsh effects. There are a few types of tetracycline. These include doxycycline, minocycline, and oxytetracycline. Mostly these types of cyclines are prescribed for the bacterial infections and acne. During these few slides, we will talk about how tetracycline affects pregnant mothers and their offspring, and why mothers would be prescribed this drug. The effects of tetracycline on the oral cavity can be very harsh and unpleasing to the eye. Tetracycline interferes with birth control. It causes congenital defects, and it may produce a yellow, gray-brown stain on the primary teeth of the mother's offspring. If taken long enough, tetracycline could cause staining on the patient's teeth. Expecting mothers could be prescribed tetracycline for many bacterial infections, and they could also be prescribed this antibiotic for their acne. Along with the reasons why a patient would be prescribed these antibiotics, their effects could also make the teeth harder to whiten, even if you're using whitening products. There are many different effects the oral cavity could have while on tetracycline. Tetracycline may cause permanent yellow, gray, brown discoloration of the teeth and enamel hypoplasia. I do not know how to say that word. Enamel hypoplasia is a developmental defect. With this defect, you could have an increased risk for decay. Oral hygiene at home is a must, and teeth may require bonding and fillings if not taken good care of at home. Enamel hypoplasia is mostly affected on the mother's offspring, so children are at high risk for enamel hypoplasia if the mother has taken tetracycline. I believe it's during the second trimester when the child's teeth and bones are developing. Although tetracycline has many harsh effects to the outside and the appearance of our teeth, there are treatment plans available for tetracycline stains. It is very difficult to treat these internal stains because the tetracycline affects the dentin layer underneath the enamel. Therefore, all treatment plans will help protect the teeth and help fix stains of the teeth from the outside in. Patients could start by bleaching their teeth. The dentist could also shave off the top layer of the teeth and replace them with tooth colored material, kind of like a composite filling. The patient could choose veneers, and the patient could also choose crowns. In conclusion of this project, tetracyclines are not recommended to be taken during pregnancy or if you are planning to become pregnant. This antibiotic can increase the risk of decay in the oral cavity, could potentially cause brown yellowish staining of your children's teeth, including their primary and permanent teeth, and could interfere with birth control. And here's my reference page. Please enjoy. I hope you all have enjoyed my project on tetracycline and its effects on the teeth. May you not take tetracycline.